Welcome and thank you for being here. You're going to hear some extraneous noises in the house. We are set up in the living room here, me and Gus. You might hear him snoring a little bit, and we have two others working from home. This is an interactive class. This is not just me talking to you. You get to ask questions. I'll be asking questions of you. This is very much like a course as if we were doing this live. So I'm not going to just be talking for an hour or so. In fact, I'm not even sure how long this will go. It'll go until we get through the information. So feel free to chime in and be sure to answer the questions when I throw them out to you. Because we want to keep it interactive. I did get an email just before we started, more than one, saying that I'm feeling extremely isolated, really looking forward to the meeting. So I think that for all of us, that if we can keep the interaction going, it's going to be very helpful for all of us. Okay, it sounds like you all know how to use the chat box, so we won't have to go over that. Again, there should be a box in the bottom left corner of your screen. If somebody knows otherwise on that location, go ahead and just put that information in the chat box. There are many levels in the course. So this is being taught as a professional course for movement professionals, which could be Pilates instructors, physical therapists, yoga instructors, personal trainers. However, everyone's invited. And so if you have a question, you're not a movement professional, you have a question, please ask. This course is for you also. And I think that's it. Oh, one other thing. If you lose me, in other words, if the screen goes blank and you're all sitting there in your homes going, oh, I will be right back. It means that the computer, the system logged me out and I have to log back in. It doesn't mean the meeting ended. Hopefully I can just come right back up. It's happened in the past. It's very rare, but in case that happens, just sit tight and I'll be there. I'll be back. All right, so on your handout, you will see that we have 3 objectives today. And the first is we're going to be able, by the end of the course, to define a breathing pattern disorder. The second is to recognize possible signs of overbreathing. And the third is to apply breathing exercises to form better breathing habits. So those are our goals today. Your introduction here is the day in the life of an instructor. I think that in one particular class when I'm teaching, I probably say inhale and exhale more than even counting from 1 to 10 or 1 to 8, depending on how we're teaching that day. And so certainly when I first started teaching exercise, it was not about, for me, the inhale and the exhale. Inhale, exhale was this extraneous thing that happened that I had to put it in there to pass the exam, but was really not that interested in it. I was more interested in, working my muscles and going fast or going slow or whatever it was. And little by little over the years, I've become more interested in breathing and the effects that it has. I will say there was a turning point where all of a sudden breathing became paramount for me. And that was on really the basis of this course, Breathing and Anxiety. And this event happened many years ago. And that event was, I was working with a child, and her mother was sitting right behind me. And I'm talking to the child and I'm saying, okay, we're inhaling and we're exhaling and we're doing this and we're inhaling and we're exhaling. And the child is doing her thing. And I turned around to the mother to say, hey, isn't she doing great? And the mother looked so ill. She just looked horrible. And she was really dizzy. I asked her if she was okay. She said no. She was really dizzy. She was nauseous. She was getting a little bit of a headache. She was not okay. And I asked her what was going on. I was concerned she'd eaten something for lunch. This was shortly after lunch. I just didn't know. And she said, no, I was trying to do the breathing exercises with her daughter. And she had just hyperventilated herself, overbreathed herself. into a state of anxiety and illness. And so today's topic is breathing and anxiety. And that those two can be flipped, breathing and anxiety. So breathing in this example I just showed you caused this woman anxiety. And those symptoms don't go away immediately. So she can start breathing regularly, normally with better patterns, better habits immediately, but those symptoms don't go away for quite a while. It's kind of like if you're in a car accident and everything's fine, but you're shaking for another hour or two. You know, you flooded the sympathetic nervous system. And it takes a while for the sympathetic nervous system to kind of be like, well, okay, we can slowly start to calm back down. It's not immediate. Now, the opposite, of course, is true. We might be anxious about something, and that causes a change in our breathing. And from the discussion we just had about my client's mother, we know that the breathing now affects the anxiety. And so this is the whole topic today, which is we don't want to have anxiety, breathe differently, and then the breathing differently causes anxiety. We have anxiety, it causes us to breathe differently. We breathe differently, we have anxiety. So even though you might be feeling okay about the situation at any given moment, your breath pattern down here is still feeding the anxiety. So you're out in the garden or you're making amazing dinner, you're being super creative, you just saw a client online and you're like, it is just heavy. And you're just wondering why it's so heavy and it doesn't go away. And it might be that the breath pattern has changed down here. And so that is really why we're having this discussion today, to make sure that we are aware that that pattern is possible. Not necessarily probable, not necessarily happening to all of us, but that it's possible. So that when you're working with a client or you're having a self-discussion, that you're like, okay, let me just check in on my breathing and let me practice some breathing. All right, so moving on, very quickly, anatomy of breath. So if you all can tell me somebody type in the chat box, or all of you can, what is the number one muscle of breathing? The one we always talk about? The diaphragm. Yep, the diaphragm. And if anybody wants to, and the diaphragm is a muscle that if I were to cut myself in half and place my top half over there, you would be looking down at the diaphragm. It wraps like a parachute from all the way to the front, the side, the back. So it's kind of that dividing line between the lungs, heart, and the organs. That's where the diaphragm sits. And so what are some other muscles that on healthy breathing we're using on, even if it's just a little bit on every inhale, exhale? You can think of some of those besides the diaphragm. The intercostal muscles, so those are the muscles in between the rib cage. Yep, what else? The lungs are definitely operating. They kind of respond, they kind of recoil and coil up in response to the diaphragm moving. So they don't have a muscle themselves that moves back and forth, but they are acting as a coil and recoil. Yeah, vacuum and devacuum, something like that. What about some of these abdominal muscles? Anybody have any thoughts here on what muscles might be working on an inhale or an exhale? The heart muscle is actually tied into breathing, and the rate of the heart does affect the breathing. Very good. The oblique muscles, sure. So the internal obliques, which are kind of the muscles that are like the jeans pockets, they sit in here, and then the external obliques up in here. You could think about the transversus, and then even a little bit the TA, exactly. So the transverse abdominis. And then even on healthy breathing, you might get a tiny bit of activation up in these, the upper body, the shoulder muscles, whether it's the levator or the trap. And then the more heavily we breathe, the more engaged they would become, even on a healthy breath. If we were running, if we were cycling, if we had high aerobic activity, then these muscles come into play. What we don't want to have them do is come into play like in a strong way when we have relaxed breathing. The scalenes. The serratus, serratus anterior. So there's a whole bunch of muscles there. And then we have the muscular consideration of breathing. If we have muscles that aren't operating to their optimum, then, or the nerves aren't innervating those muscles to the optimum, then they're not going to do their part. And of course, the diaphragm would be the biggest concern. So the nerve that feeds the diaphragm is anybody know which nerve that is? It's not something we talk about every day, but I'll wait a second to see if anybody wants to chime in. The vagal nerve is an important part of how the diaphragm operates, yes, but the one that like feeds the muscular contraction is going to be the phrenic. Awesome. And so the phrenic nerve feeds that muscular contraction. The vagus nerve we're going to be talking about in just a moment, and it is important. Changes to the phrenic nerve, if you were in an accident that damaged the phrenic nerve, then certainly now breathing is a concern. Fascial changes. If you had a surgery and now you have dense connective tissue that's restricting movement of the rib cage, then this is a physiological component that is going to restrict the breathing. The bones. So of course, scoliosis. Here we go. So if your spine is scoliotic and you have changes to the shapes of these bones, which are therefore going to feed into changes into the shape of the rib cage, then the breathing pattern is going to be affected as well. There's a free YouTube video up there right now. It's called Breathing in the Rib Cage. That talks quite a bit about that, if you want to see that. I interviewed Stuart McGill recently. That interview is also up on YouTube. He is the author of Low Back Disorders, Back Mechanic, and Ultimate Back Fitness and Performance. I think that's the name of that last book. And he said in the interview, he said that he was in an accident. He had a ice hockey injury when he was younger, and the hockey stick went through his ribs. And so that caused a change in the relationship of the ribs and the muscles there. And so and he has scoliosis now. Now, whether it was a result of that injury or beforehand, he wasn't completely clear, but I think it was a result of the injury that changed the shape. You change the relationship of the tissues underneath, and of course the lungs. The diaphragm, the breathing is definitely going to be affected. Okay, let's talk about the vagus nerve just a little bit. So the vagus nerve, it can help us, and it's going to be important for a breathing discussion. The vagus nerve can help us to normalize the breathing pattern. And one of the best ways to do that is to stimulate the vagus nerve. If we stimulate the vagus nerve, and then the heart rate comes down, the blood pressure comes down. And the easiest one way to stimulate the vagus nerve is to just take a big exhale, not a big inhale, a big exhale. And so if you've seen some of my videos recently, if you've worked with me, you know that the focus is always exhale, 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 exhale. And so we are going to continue with that. We want to continue that pattern. And there was one other thing. Oh, right. So another way to stimulate the vagus nerve is really just reflecting on something positive, looking at positive pictures. I watched a TED Talk years ago, and there was a woman, she owns a gaming company. So if any of you have kids at home, they might be gaming right now, or these days a little bit more. But and she had a traumatic brain injury. And for her to recover from that traumatic brain injury, she turned it into a game, which is now a game that her company has, or you can find maybe free online, I'm not sure. But part of that game was that we have to increase parasympathetic activity in the body. We want to, and that's the rest and digest, or sometimes it's called the tend and befriend. And so that idea of reaching out on social media, or the idea of all of us coming together to reach out, is going to harness and push and encourage that parasympathetic activity in the body. And that's the vagus nerve. That's partly the vagus nerve. So if we can spend 3 minutes on Instagram, looking at pictures of puppies and cats and happy people doing dances in their living room during quarantine, then this can feed that. You want to be sure to unfriend anybody who's posting out things that would increase your anxiety. You want to be sure that you're using those outlets the way that you want to use them. And if you're using them to decrease your anxiety, then you want to be sure that you're friending the right people who are posting things that are safe for you in terms of feeling good. Okay, so the vagus nerve. All right, so let me make sure. Okay, so muscles, the next thing on your handout is checking in with our clients. And are they breathing well? And are they breathing in a way that is increasing their well-being? Or are they breathing in a way that is going to increase their anxiety? And there's a couple of ways that we can check in to know that. And the symptoms, if somebody is breathing with poor breathing habits, there's going to be symptoms immediately. You don't have to wait for them to get home and call you. You don't have to wait till next week. You're going to see it right away. And some of those symptoms are dizziness, lightheaded. Have you ever taught class? Because this used to happen to me all the time. Have you ever taught a class and everybody's inhaling and exhaling, and it's beautiful, and you're all getting ready to move, and big inhales, and then 2 or 3 people in the class are like, "Whoo, dizzy." I'm not used to that much oxygen. And yeah, so that's really not good. That's really taking us in the wrong direction of where we're trying to go. And what they're actually telling you, and what they were telling me when I was teaching that way, was that you're teaching wrong. Number one, they were telling me that without using those words. And number two, they were telling me that they were using really poor breathing habits to accomplish that inhale and exhale. Had we continued, they would have ended up in the same situation that my little client's mother had, saying that I don't feel good, I need to go lay down. And so dizziness, lightheaded happens sometimes right away, and can be a really great cue to you as the instructor as to, okay, this is a person that we need to focus on breathing habits with, and we need to slow this down and talk about this. Okay, so that's one common sign. The next one is frequent sighing. This is actually one that my son does. And so when he's nervous, he sighs a lot. And I know that I do too, because when I'm at my computer and then John will say, "Everything okay over there?" It means I've been sighing a lot, and it sounds like I'm stressed, and I'm not even aware that I've been sighing. I remember taking my son to college, and it was about an hour and a half drive. It wasn't that far away, but it was our first, we were taking him to college, and he was going to be living there. And he was sighing the whole way there. I mean, it was it's kind of like self-calming. It's kind of like, I need oxygen. Apparently, probably what had happened is his breathing had been moving so rapidly that he was trying unconsciously to settle his breath with the sighing. Okay, so the third one I have here for you is tingling. So if we have if we're breathing and we feel tingling around the mouth and the nose, for me, it will happen more in the nose, like the bridge of the nose, and then fingers or toes. That's a sign that the breathing pattern that you've set up is a little bit wonky. Upper body tension. That could be a way of knowing if you're, we're at the computer all day long and we're like, it's because I type like this. Well, it might not be all that. It might be that when we're at the computer, we often hold our breath without realizing it. We often hold our breath when we're texting. There was a great study I found. I don't think it's in your handout, but that said we tend to hold our breath when we're texting. So the same is probably true when you're sending a certain email, or if you're a writer, you're working on a work document and you're like, I've got this thought and I want to get it out, and you're like, there's a good chance you're holding your breath for some of that. That's going to certainly contribute to your upper body tension that you might already have at the computer. Muscle cramping. So muscle cramping is an interesting one. And this is one that I've seen my mother experience. And I'm really sorry, I can't think of the word off the top of my head. Maybe there's somebody that knows it online. But there's a cramping that happens that the fingers actually move together. And there's a word for it. And I'm so sorry. There's another hand cramping also that can happen. Did somebody just write in? Okay. So in any case, that hand cramping is kind of classic for, can be a classic sign for a poor breathing habit. Happens with my mom at times. And whether it's happening because of her breathing or because of, she's sitting down sewing, I'm not really entirely sure. But trigger finger, it might be the common name for it. I'm actually not sure, Sophia, if it's called trigger finger. It's a word, it starts with a C. I can't think of it. But I can send you it in the email, the follow-up email from this course. Okay, so these are some common signs, and there are more, and we'll talk about those later. So the 5 that we talked about here were dizziness or lightheadedness, frequent sighing, tingling around the nose, mouth, fingers, toes, upper body tension, and muscle cramping. Those are some things that you might see with your clients or with your patients. All right, let's talk a little bit more down the road here. Let's turn this over. When to refer to a medical doctor, always. If you have any concern at all about what's going on in your studio or clinic, then yeah, send somebody. It's always great to gather great information, right? And they're with you because they want to gather great information, and you have that. We can't all have it all. Wouldn't it be great if we could have 5 different professions poured into our head and the amount of time it takes to study one profession? So that doesn't work, and that's not possible. So always refer out. And I tell my scoliosis clients all the time that they need to make sure they have a good relationship with a medical doctor. And it's not because, we need you to have surgery this week or next month or next year. It's because these medical doctors have great experience and great background, and we want all the best information we can gather when we're trying to take care of a situation. So same thing with breathing. Does yawning go along with frequent sighing? Yes. Thank you for asking, Kathleen. It does. Yawning can go along with that. Yeah. So refer to a medical doctor whenever you have any question about this. So the next thing we're going to move on to here, and we'll go back to a discussion in a moment about doctors. And keep your questions coming, everyone. Don't save them till the end because I'll forget what I've said. Okay, so let's talk about a common habit with breathing. And we can talk about poor breathing habits the same way we talk about poor postural habits. Now, scoliosis, again, is not a postural decision. This is not, I didn't wake up one morning and go, what would be super cool? Is this would be awesome. So no, it's not, this scoliosis is not a postural decision or a postural habit. Postural habit is I choose to type like this, or I choose to type like this. If I choose to type like this pattern of typing could increase a poor breathing habit. Do you know why? Why would typing like this create a poor breathing habit? What am I doing to my diaphragm? What am I doing to my lungs? Why would it be? So go ahead and type that into the chat. Yeah, that's it, Wendy. You're limiting lung and diaphragm space. And Jessica, compressing. Carla, squishing them. Yes, squishing. That's right. That's exactly it. And so you're not giving the organs the space to do what they need to do. It would be compressing my diaphragm this way would be the same as compressing my hands like this and saying, okay, now do your job. And like, well, what job? Well, write. You know, want me to write with my hand, you know, in a fist like this. It's just not going to work out. Okay, so if we can start to see breathing habits similar to posture habits. You know, I'm trying to sit here with my good posture habits of elongation and you know, kind of freeing up my spine. And the same with my breathing. It's not as easy to be aware of our breathing habits. It's really easy to be aware of our postural habits because someone can take a picture and we're like, oh, well, look at that. But with breathing habits, it's a little harder. So the breathing habit that we're going to focus on today is the one that we most commonly see in a Pilates studio, in a PT clinic, and that is an over-breathing pattern. And sometimes it's called chronic hyperventilation, or it's called hyperventilation syndrome, HVS. And with hyperventilation syndrome or overbreathing, there's 5 things that we're going to focus on today that you could see. And the first is that the breathing is, the depth is more shallow and the breathing is more rapid. So instead of completing 10 to 14 breaths in a minute, maybe you're completing, over 16. It could be higher. We did this, we were teaching in China, which is actually where I'm supposed to be right now. No, Japan. Everything got canceled. So we did this great test in China when I was there last in September. And we asked half the class to leave the room. We had a lot of students, maybe 40, 45, can't remember, a lot. We asked half to leave, and then I told the other half, I said, okay, this is what we're going to do. When they come back in, we're going to have them lie on the mat, and I want you to count how many breaths they take in a minute. And the reason we had to send them out of the room in order to do this is the moment you say to somebody, I'm going to look at your breathing, and I'm going to see how many breaths you take in a minute, well, then they immediately change their breathing. It's really hard to talk about breath and not have somebody change their breath pattern. So if you're going to measure how many breaths someone's taking in a minute, don't tell them what you're doing. And the other thing you can do is, I'm going to share my screen now. You can get a pulse oximeter from CVS. And let me just flip over here really quickly. There they are. There's I just put pulse oximeter into Google search, and then I clicked on images, and all these different images came up. So they tell you your pulse, but they also tell you generally how many breaths you're taking in a minute, what your pulse is in a minute, and what your oxygen saturation is. So these are pretty great and really useful. You could just pop that on somebody's finger and see what their breath rate is in a minute, if you're concerned. All right, let me just flip back over and stop screen share. Okay. All right, so that's number 1 there. Okay, so when your breath becomes more rapid and more shallow, then actually what happens is the carbon dioxide in your blood reduces, the pressure of carbon dioxide reduces. So you have a situation called hypocapnia. I'm going to type that in here so you can have the spelling on that to put in your handout. Hypocapnia. And when we have those, when we have the carbon dioxide lowering in our body, we have a system in our body that becomes more alkaline. So the pH lowers. And then if the pH lowers in your body, at least if you've got this, they call it respiratory alkalosis. So it's like your respiration has created a system that's more alkaline. So the, I guess it would be alkaline. Acidosis would be a low number. Alkaline would be a higher number. And so the body isn't going to tolerate that. The body is never going to tolerate much of a change in acidity or alkalinity. So I think the 7.4.4, I think, let me know if I have that number wrong, but I think 7.4, yeah, 7.4 is your baseline. That's where we all pretty much live all the time. You might climb to 7.9, you might go down to 7.1, but your body really lives in this very small range. And by the time you've hit 7.9, you're not feeling very good. So my client's mother, who was having that dizziness and that nausea and really not doing well, her pH had become very, quote, very alkaline. She's all the way up here at 7.9 when normal is 7.4. And then if you reverse that, if you have a more acidic system, then you're talking about 7.1. Much out of that range, and we're going into a coma, we're dying. So when somebody says your system's very alkaline or it's very acidic, make sure that you're getting correct information there. Nobody's living outside of the sevens, not for very long anyway. Okay, so anyway, let's say our baseline is 7.4 and we climb up to 7.5 and we're too alkaline and the body reads it's too alkaline. Okay, well then the kidneys take over and they're like, okay, it's too alkaline. Let's get rid of some of this calcium. So the body starts flushing calcium. It'll leach it from the bones. It'll take it out of the body, whatever it needs to do. It'll take calcium out of the blood. So to make your system come back to normal. So respiratory alkalosis, where the pH goes up, will be solved by renal, what's the word? Not absorption, renal compensation. Apparently vocabulary is not my forte today. So it's something to be aware of, that this is happening all day, every day. If you are chronically overbreathing. Another point here is, so if you're overbreathing, it's defined as an excess of your metabolic requirement. So if you require this much pressure of oxygen and this pressure of carbon dioxide, and all of a sudden you're messing around with that, then that could be overbreathing, or overbreathing will result in a metabolic disturbance like we just described, where now the kidneys have to jump in and take care of the extra alkalinity in the body. We already talked about the pH becoming more alkaline. Adaptive changes in response. The adaptive changes in response would be the kidneys. So let me just write down or read to you what I wrote here as your key points, so you have those. So the question is what is overbreathing or hyperventilation syndrome? And in a nutshell, the breath, number one, is going to be more rapid and shallow. Number two, we have a situation of hypocapnia or reduced carbon dioxide. Number three, overbreathing is defined as in excess of metabolic requirements. So in excess of metabolic requirements. The next one is adaptive changes. So your body starts to adapt to the changes you created. And the last one is that your pH becomes slightly more alkaline. ever so slightly, because then the kidneys come in to take care of that, to return you to normal. Okay, so the prevalency is the next question. We have two studies here. One is LUM, 1975. Let me write this down for you. LUM. The study is in your handout. LUM, 1975. He says that 6% of adults have a pattern of overbreathing. And then we have Rice. I'll write this down for you also. Rice, 1950. He says that 10% of adults have a pattern of breathing habit of overbreathing. So it's interesting when we look at the history of overbreathing, and it's been called different things in the past. So if this is something you haven't heard of before, you might have heard of it. Very, very early on, 1871, study by DaCosta. DaCosta this is a study that's also in your references here, or on the last page. He called it irritable heart. So when soldiers were returning from war, he looked at 300 soldiers, and he found that they were suffering from breathlessness, chest pain, palpitations, dizziness, headache, and disturbed sleep. So all of these things, we talked about 5 symptoms of overbreathing at the top of the second page that you have there. But these symptoms could also be added. Leon Chatow, who is the author of this, do I have it? I think I brought it. Yeah, this book, which is one of the references that I have here for you. So try not to get a glare on it. There we go. So he's one of the authors on this book. He talks about going to the hospital for some pretty severe symptoms. He thought he was having a stroke. And instead, this is in your references, by the way. The first author is Chatow, so therefore it must be the first in your reference list. And he was having chest pain, and he went to the doctor thinking this was really bad. And they did all the tests. They did the chest, all of it. I'm not a doctor. I don't know what tests they did. I'm just telling you what Chatow said. They ran all the tests, whatever that was. And he was there for quite a while, all day. He was there overnight. They were still running tests. The doctor comes in the next morning and he says, you're fine. Go home and learn how to breathe. And he diagnosed him with hyperventilation syndrome. So he said he was kind of embarrassed because, he's this osteopath. Well, he's passed now. He passed last year. But he's an osteopath who studied so many different aspects of human physiology and anatomy that he's a bit embarrassed humbled to walk home thinking, I need to learn how to breathe. But in any case, I want to review that list again. DaCosta in 1871 worked with 300 soldiers, and they suffered from breathlessness, dizziness, palpitations, chest pain, headache, and disturbed sleep. All components of what today, in the 21st century, most countries would call hyperventilation syndrome. And he called it irritable heart. And I think he called it irritable heart because of the chest pain, because of the palpitations. And Charles Darwin and Florence Nightingale, in fact, were diagnosed with irritable heart. It would be, let's see, when Darwin returned from his adventures in South America and when Florence Nightingale returned from war as a nurse. They were both diagnosed with irritable heart. And today they're thinking that it was in fact hyperventilation syndrome. In 1938, Scolio-Pilates, also in your reference there, found that all the symptoms of irritable heart syndrome, that all the symptoms could be could be induced with hyperventilation. So they could take people without irritable heart, syndrome, sit them in a room, have them hyperventilate, and before you knew it, they all had the same symptoms as irritable heart. So that was a pretty important finding. And that's very concerning also. Sorry, killing ants here. It's that time of year. It's very good information for those of us who are teaching exercise. Are we going to take a room full of 10 people? Are we going to take a room full of 2 or 20 or 60 and have them breathe incorrectly and induce hyperventilation in the classroom where most will be able to recover quickly? There could be 1 or 2 or 3 that aren't going to recover for hours and wonder why they're walking around after their exercise classing feeling horrible and probably blaming it on their poor health when in fact we just tipped their scale, which is a good point. Some people will have their scale tipped much, much more rapidly than others. So, and there's studies about why that is. Maybe their preset point of how much carbon dioxide is in the blood is a little bit lower. And so if you tip that a little bit, then it's just right there. You've already induced the symptoms of overbreathing. Okay. In the 70s, irritable heart was called designer gene syndrome. And so here's a question for you. You can chime in. Why would irritable heart and designer gene syndrome cause the same symptoms? So wearing designer jeans, presumably tight, cause some of the symptoms of irritable heart. Yes, tight, high waist. Exactly. Let's just crush everything and then ask people to breathe. I suspect that designer gene syndrome could have been called tight corset syndrome at some point. You know, the same problem, same problem. Those people who are wearing a brace for scoliosis, I have a lot of young ones who have worn braces or are wearing braces for scoliosis, and we definitely have to spend some time on learning how to breathe. And these children they don't necessarily, can have problems with anxiety. And it's not because they're anxious children, it's just because they have this poor breathing pattern habit set up because of the brace. And so it's really, really important to remember that we don't have to have anxiety in order to have a bad breathing habit. That breathing habit all on its own can create anxiety. Like if you're sitting there staring out at the ocean and all of a sudden you feel like you're going to lose it, then, it's a stressful situation right now. There's no way around it. But we don't want to increase that for sure by wearing clothes that are too tight, or by not recognizing that we've set up a poor breathing habit that we can work to change, which we're going to talk about. Okay, so to finish up, and then the other name that was given to this syndrome in the past, I've still seen it used today. We had the Gulf War syndrome. Does anybody remember hearing about that? You can type in if you remember those days. Balkan War syndrome. Anybody remember that? Soldiers coming back and having these vast syndrome of symptoms that were a bit vague, and they weren't quite sure how to care for them. And these symptoms slowly went away the longer the soldiers were home from war. Yeah, unfortunately, it doesn't go away the moment that we stop the stressful situation. And that's what I would want for all of us, is I would just want to have the awareness that this is what we're going through. It could change my breathing. Let me focus a little more on my breathing now, so that when I am having a great time on FaceTime with my family, or watching a great movie, that I'm not still living up here in this anxiety. Or for our healthcare workers who are having a lot of stress at work right now, how can we, take the drive home to work on our breathing so that when we get home, we don't have to carry the anxiety back with us as much. And then when this is all over, when we're all looking back on this and saying, wow, then can we also be done with it at that point? Can we say, okay, let's get the breathing back on track. Let's make sure my breathing isn't what's keeping this habit of anxiety going. The breathing habit, creating the anxiety habit. Okay. So all in all, let me see where we are here. So the additional symptoms of overbreathing that we didn't mention on the first page here. Oh, Wendy, thank you. Wendy says, this is fantastic as I am currently focusing on meditation too. Perfect combination. Perfect combination. Yes, 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 it is. Make sure you exhale. We'll talk about that in a minute. Okay, so on the previous page, we talked about the symptoms that your client might have a poor breathing habit or an over-breathing habit. And I just wanted to add some symptoms here to that. So your additional symptoms that we didn't talk about on the first page were breathlessness, almost like a air gulping type situation, like a kind of thing. Palpitations, chest pain, headache, disturbed sleep. These are all things that, of course, you would talk to a doctor about before assuming that you were over breathing. These are not things that these are all concerning things. The whole list, the ones on the first page, the ones on this page, these are all things that you would have to have a tele appointment with your doctor about or something and say, okay, just need to make sure that I'm on the right track here. These are symptoms that tend to follow fat folder clients and patients around. You know what I'm talking about? So like there was a time in my life when I was a fat folder patient. I had horrible migraines for a really long time. And this is back when they would bring paper into the office treatment room. And so my folder was just getting fatter and fatter and fatter. I had all these symptoms that I didn't know what to do about. And the migraine was at the center of it all. And the migraine was causing anxiety. And the anxiety was causing the breath pattern change. Now I know this. And then the breath pattern change was causing more anxiety, more headache, more migraine. And then it would swoop down to a matter of poor breathing and then back up to the migraine and back down to the poor breathing. It's just like this horrible, horrible circle of symptoms. And so you want to make sure that if you are working in a PT clinic and somebody says, well, they might be a malingerer, we have no idea what's wrong with them. These are frequently people who are your over-breathing people. Okay, so assessing the breathing of the client in front of you. We already talked about the pulse oximeter. We talked about using, just a very objective tool. You can lie your client in front of you on a table and tell them if they could just lie quietly for a minute while you take some notes. It's really important that they not know that you're counting their breath, the number of breaths they're taking in a minute. And again, it's 10 to 14 breaths in a minute is considered the norm. And then over that is we're starting to creep higher and higher and higher into an over-breathing pattern. There's the high-low breath assessment. Many of you probably already know this. You can do it with me. You place a hand on your chest, that's high. And then you place a hand on your abdomen, that's low. And then you just ask your client, you can do it with me now, to just take a tiny breath in and then exhale all the air. Keep blowing, keep blowing. And then when you're ready and you need to, go ahead and inhale. And you want to assess, self-assess, or assess in the, or your client can self-assess themselves. You can watch them do this. And you want to see what's moving more. Is the breath moving up here? Is the breath moving down here? One problem with asking people to take a deep breath in is if you cue anybody on the planet, anybody that has even amazing breathing habits, to take a deep breath in, they're assuming that you want them to take the biggest, fastest possible breath. And if they do that, they're going to do this, right? And so you want to make sure that that's not what they think you're asking them to do, because they will give you that kind of breath pattern. And it turns out to be paradoxical. So if we go back to high-low, I think paradoxical, I have that next actually. So paradoxical, and I'll give you this list again in a minute. So the paradoxical pattern being that when you take that really fast, big inhale, do it with me, then the waist actually gets smaller and the circumference up here at rib 3, right underneath the armpit, gets bigger. And so if you're just resting, you're sleeping, you're doing what Gus is doing over here in the chair, not paying attention to his breath, then the breath is generally going to expand the low rib cage. You're going to get the tape measure, if you wrap it around the ribs, is going to increase here. It's going to decrease here. But the paradoxical pattern is that it increases here, it decreases here. Now, this is another whole version of a poor breathing habit that needs to be changed. I have seen little ones who wear braces, again, for scoliosis. I have seen them that when they come out of their braces, they have a pattern of breathing that is a little bit more expansive at rib 3 than down here. And of course, you can imagine why that is. They're compressed here. They can't. So they get into the pattern of breathing very high up into rib 3. Okay. All right, so I think that was it here. 3 ways to assess. I think I gave you 4 there. So the first one we talked about was the pulse oximeter. The second one was to count breaths per minute. The third was the high-low breath. And the fourth was to consider paradoxical breathing and whether they're actually normally breathing in a paradoxical pattern, or whether you cued them in such a way that that's what they're giving you because they think that you want massive expansion. They're just trying to do their best for you. She said inhale, by golly, I'm going to inhale. And so they end up here. Okay. So let's talk about how we change this pattern and some exercises. And can anyone think of a way to begin to change this pattern? What are some ideas that come to mind for you? You can just type them in the chat box here. So if anybody has any thoughts, you can type them in there. I'll give you another few seconds here. Oh, here's some ideas. Yeah. Tactile feedback. Definitely. So they know where that you want them to be breathing from. Counting. Yeah, we're going to actually talk about a method of counting the breath to kind of slow it down as opposed to having the rapid short breaths. Yeah, the rapid shallow breaths. That's it. Good job, Fran. Peggy, focus on your breath. Yep. We're going to be talking about how to focus on the breath in just a second. And Jessica, forced exhale. Yes, forced exhale. Absolutely. And Amy, awareness. Yes, all of these things. And Wendy, you mentioned something earlier before, which is meditation. So these are ways, these are tools. We're going to start with the tool that many of us are familiar with, and that is the Pilates breathing. The Pilates breathing talks about posterior, so the back, and the lateral breath. In Scolio-Pilates, we talk about moving the chest all the way around so that we don't want to confine or compress or hold this when we're practicing breath. It's different when you're, trying to hold a teaser or a sit-up or something. But it's going to, for today and for the sake of practicing breath, then what we want to focus on is that when we do finally inhale after that long exhalation, then we do want the entire circumference of the rib cage to move because that's where the diaphragm is. If you've got a muscle sitting inside at this level that's shaped like a parachute, then when that parachute blossoms out, it needs to push in all directions, not just posterior, not just lateral, but all the way around, because that's what the diaphragm does. And so if you can practice this with me, hands on the ribs, I'm going to just lay my legs flat on the mat here. And from here, we're going to start with just this tiniest little inhale, just as a rhythm marker to get us started. And so it's going to go like this, little tiny breath. Now exhale all the air, and you're just going to keep blowing and blowing. You're going to feel your ribs funnel down. You're going to feel probably your butt muscles start to squeeze and your pelvic floor lift and the roof of your mouth float up and your chin drop down, your jaw drop away. Now inhale only when you have to. When your body is telling you that we really need to take an inhale, then inhale. Don't keep holding your breath, just inhale. And don't try to inhale, just let it happen. And then you exhale all the air, keep blowing, keep blowing, keep blowing. We funnel, we squeeze the butt muscles, the pelvic floor rises, roof of the mouth up, jaw drops down, and then you inhale when you're ready. The inhale is free. You've created a vacuum. Just let your body do what it knows how to do and fill that vacuum. Now exhale all the air. Exhaling, exhaling. You can push the knees down. That helps to squeeze the butt. Pelvic floor lifts. Roof of the mouth floats up. Jaw floats down. You're floating, you're floating, you're floating. When you feel like you have to, go ahead and inhale. And then just breathing normally from there. Good. And then you can give it a little wiggle. Okay, so that's the idea. The idea is always going to be that very long exhale. And earlier when we were talking about the vagus nerve, one of the great easiest way to increase tone of the vagus nerve, which basically means to increase activity of the vagus nerve, is going to be that long, slow exhale. And not to hold your breath at the end of the exhale. That's another form of breathing exercise, which we could focus on in the future, but not today, is let the inhale happen when it needs to. So don't let yourself become stressed, like I'm going to exhale, I need to exhale farther and more and more and more. No, everybody is totally different. Everybody has their own wave, their own rhythm, their own pattern. And so when you feel like you need to, inhale. What I'm asking you not to do is to say, I've exhaled everything. Let me take the world's biggest inhale and I'm going to force the inhale. Don't force the inhale. Your body knows how to do it there. Spelling on what, Elizabeth? What did I say? Trying to think what I said. Oh, vagus. The vagal nerve. Vagus nerve. Yep. Vagal tone. There you go. Thanks for asking that, because I wouldn't have remembered. All right, and if there's any other questions, go ahead and type them in, everybody. Okay, so that's one way, and that's our jellyfish breathing. So we have the posterior lateral breathing of Pilates, and then in Scolio-Pilates, we teach the jellyfish breathing, which is what we just did. If you can imagine the diaphragm, as this jellyfish that just moves out and it comes in and it goes out, and the out is the inhale. The outward motion of the jellyfish is the inhale, because as the diaphragm goes down, it pushes the ribs away. So when you think of a jellyfish moving and it goes, that's the inhale, and the jellyfish pushes the ribs away in a big circle. And then the exhale is when the jellyfish does this, and it swims away. And when it opens up, it's kind of when it slows down. That's like its initiative, and then its momentum, right? Impulse. That's the inhale. The ribs go down. The ribs move away. The diaphragm goes down, and that's the momentum. So impulse and momentum. Impulse and momentum. Okay. All right, so then we want to work on range of motion in the upper body. Was there a question here? Okay, I see things popping up, but I don't see. Okay. So the next one is range of motion for the upper body, and that is that we want to make sure, like we talked about earlier, we have these muscles that are part of the mechanism of breath. Well, we want to make sure there aren't any restrictions. Oh, Suze. Sorry, make sure I know what's happening here. Oh, spelling of vagus nerve. Yeah, okay. So, so if we talk about scoliosis, it's easy to see how the ribs would be if you side bend, if you just side bend right where you are. You can and create a type of functional scoliosis for just half a second. Then you can put your fingers in your rib cage. On the side that's open, the ribs are way open, and on the side where the ribs are closed, or I'm sorry, the side, the downward side, the ribs are super close together and practically overlapping. Well, if you try to breathe in this position, you can see where there's a bit of a restriction, and it's a little bit tough, a lot tougher than coming back up to center. And then when you inhale, you can feel those intercostal muscles spreading apart and stretching and then contracting back down. So reducing the restrictions around the rib cage, and that can be like everything from like the base of the skull all the way down to the pelvis. And so just some exercises that you already do, and just maybe I'll give you some thought to them on opening up the rib cage here, is first of all, there's mermaid, right? So if you bring your hand out to the side from where you're sitting, and well, actually, let's start with both hands overhead. So if you can, clasp your fingers and push your palms up to the ceiling. If that doesn't work in your shoulders, then just open the hands here. And then you're going to place your right hand down on the floor next to you. And then you're going to reach up and over like a big giant rainbow. Don't sink down into this position, but you're going to go as far up to go over. But once you're in this position now, you're going to take your left hand forward on a diagonal. And you should be able to feel how that stretches the muscles on the back of the rib cage. So the lats, perhaps. And then we come back, and then we come up. And then take the other side. So now left hand goes down, right hand reaches up, reaching up to go over. Don't sink to go over. You can take a breath here. Exhale all the air, all the air, all the air, all the air, all the air. And then let the inhale happen. You'll feel the ribs on top stretching apart. And now forward on the diagonal, a little breath in, big exhale out. And now when you inhale, it'll be really big. And you should feel those ribs stretch apart. Coming back to center and here. So one more time on each side, the hand goes down. The opposite hand reaches up. We work our way over, stop here, little breath in. Good job. Exhale all the air. Inhale, spread the ribs apart. Good. Exhale, rotating, reaching. And then hold this after you've exhaled all the air. Big inhale. You'll feel the muscles on your back on the left side stretching apart. Here, back to center. Last time, we're going to go here, reaching to the sky. Up and over you go. Little breath in. Exhale all the air. Giant inhale. And then exhaling. And that giant inhale was free, not forced. Exhale all the air. Exhale all the air. Once you've exhaled all the air, inhaling. Your inhale is free. You come back to center and you come up. And so then we're combining the breath pattern that we were learning with jellyfish breathing, and we're combining that with trying to de-restrict portions of the torso to allow the breath to happen more freely. Some other thoughts here are dove. I think this is a Tai Chi move, right? So you have the arms coming together and then the arms coming apart and even behind you, opening up the chest. So we have the hands coming together and then we slowly open up the chest. So again, trying to undo some restrictions in the chest. We could also do swan. So in yoga, somebody's going to have to help me out here. What is swan called in yoga? Is it, I'm afraid to even say anything and make a fool of myself. So in swan, we are here and we want to focus on, yes, Gussie is being very patient. We want to focus on lifting the chest, upward dog. Okay, I was thinking about that, but I was afraid to say it, upward dog. And so one thing to think about here is there's many different ways to do this, but if we start with our hands next to our shoulders, we push our palms into the floor, we push our elbows into the floor, and now I've got this nice sticky mat. If I push my elbows isometrically towards my heels, then my chest gets to float up, and I can take my chest towards Gus here and really spread the front of my chest open and coming down. What we want to avoid here is getting into that habit of moving from our flexible spots, or in scoliosis, those transitional zones. So it's super easy for me to move like T12, certainly easy for me to move down in the lumbar, but I'm not really getting much stretch in my chest here, which is my goal at the moment. Oh, that's Cobra. Okay, thank you. Cobra. All right, so from here, hands into the floor, elbows down, push the elbows back isometrically, squeezing my butt muscles just a little bit to assist me here. And I'm going to open up the chest. I'm not trying to break my neck by looking at the sky. And so I want to open the chest to come down. There's different ways to do this. You can take the hands behind you. You can reach up. Without the support of the hands, it's way easier for me to dump into my low back here. So for me today, since I've been sitting for an hour chatting with you, I better keep my hands here. Hands down, elbows back, opening my chest to breathe here. Now from here, we can also take the arms forward, come up just a little bit, and then we can rock the ribs to the right. So this is center. I'm going to rotate my ribs slightly to the right and back to center. There's not a lot of rotation allowed here because of the position of my hands. But if I start in the center, I push my palms down, I pull them isometrically back towards my stomach, and then I take my ribs and try to look towards you with my ribs. I get a little bit of movement in my thoracic, and I come back, I lift my chest, and I take my ribs to the left, trying to move in the thoracic, and changing, and back to center, and changing, and back to center. So that one's much more isometric. So one last one for you here, trying to open up the chest here. And then I have another exercise for you after that. But opening up the chest, thinking about a full motion row. I better face the diagonal here. Okay, so we have rowing, right, that we might do on a Pilates reformer, but I'm talking about a row that you would do if you were actually rowing the boat. And so we're going to start, we have our handles, we're going to pull, and we're going to go forward. We're going to pull, so we're making a circle with the arms. And those of you who are movement practitioners, you can probably imagine very easily where we could go next with this, right? So we go pull, stump ahead. My nose is right over my pubic bone here. So I'm right here making a letter C. And then I go forward the head drops over my knees, and I come up. So I'm not trying to go all the way back into a sit-up here. I'm trying to stretch my back muscles, head over my hips here. I take my arms forward. I'm stretching my upper back as my head goes, the top of my head is over my knees, and I come up. And so again, here we go. So head over my pelvis, top of my head over my knees. I stretch my upper back and I come in. So this is just a nice way to get the back to stretch, to open up all those restrictions. Just a variation on a theme that you may already be doing. Okay, last one here, and this is, Fran, I think what you were referring to earlier in the class, or something like it. Oops, wrong one. And that is, you talked about counting the breath in order to, as a way to either slow the breath or to change your breathing habit. And there's, instead of counting, we're going to use the alphabet instead. So you can do either one. And it looks something like this. So I take a little inhale and I say loudly A, B, C, D. And I inhale. And then I say loudly E, F, G, H. And then I inhale. And I exhale I, J, K, L. And then I allow the inhale to happen. So you could use numbers. I'm going 4 letters at a time. You might go 5 letters at a time, and that's the idea, is that you want to increase it. And it's nice because it's quantitative. You know, you can write it down. You can say, well, they started with 4 and they went to 5 and now they're at 6. So if I were to use numbers, it would be little inhale. 1, 2, 3, 4, 5. You're pretty cute. And then 6, 7, 8, 9, 10. Inhaling. 11, 12, 13, 14, 15. So it's important that it's loud because why? I bet you can tell me. What happens if it's loud versus it being spoken like I'm speaking now? First of all, it's not nearly as annoying for the people in the house. But when it's loud, it does something. What does it do? You can tap in the chat box here. We're almost done. I'm sure you're tired, getting a little bit tired. More oxygen, more exhale, and ab action. Yeah. So we're actually, when we're speaking, we're actually pushing the carbon dioxide out of our body. So when we're speaking, it's an exhale, right? It's an exhale, exhale, exhale. As I'm talking. I eventually have to inhale because talking is an exhalation pattern. And it's dynamic. So what we're really focused on when we're being loud is that we have more carbon dioxide going out. We have more muscles working. And so it becomes, as it's the difference between taking your exhale out like this, and that can go on forever, right? Or just going, and it's all out on one blow. So we're trying to maybe expedite the pattern or the habit there to move forward with the client or the patient, whoever you're working with there. So and again, it's quantitative. So you can use the alphabet. It's a little harder cognitively. You have to remember the alphabet. Numbers are a little easier. So 1 through 4 or 1, 2, starting wherever your client is and then moving your way up. And it's a really great way for them to see how they've progressed. So to finish up, what I really want to leave you with today is the sense of, number one, the sense of community, that, we all are here and we all are going through this together. And when we are at home alone and feeling isolated, reach out. There's everybody practically on the planet going through the same thing right now. And the other message that I really wanted to get across today is that that I've mentioned a few times today, the anxiety and the breath, and how you're so welcome, Elizabeth, and how they can feed into each other, and to take a look at that and make sure that you haven't gotten stuck in a vicious cycle, and that when you're working with your clients and they're feeling a bit overwhelmed, checking in with them to see if they haven't gotten stuck in a vicious cycle as well. And that's it. Let me know what you think about the class. Most likely going to turn this into a bit longer of a class and put it up for CECs for everybody so that you have that. And that's it. You're breathing better. I'm so glad, Elizabeth. That's great news. And I'm just going to hang out. I'm not going anywhere immediately. I'm not closing the meeting. So if you have any questions, let me know. I'm just going to sit tight for just a few more minutes. You're very welcome. You're very, very welcome. Thank you, Christine. Thank you so much, Fran. Thank you, Jane. Thank you, Kathleen and Jessica and Jill and Carla. Thank you, Monica and Peggy, Sophia, Nisreen, thank you. I hope you're all doing really good. Allison, question. I'm a singer and we are told on the inhale to, yes, that's really different. Yeah, I'm told as a singer, we are told on the inhale to release all the low ab muscles. I find that hard to reconcile with good pelvic and postural support. Thoughts? It's a great question, Allison. I've worked with actors and singers that have similar questions, or practically the same question. And I think what you're going to have to separate then is, I'm not a singer. And so I think you're going to have to separate the profession from the habit. If this is what they're teaching you, then there's a reason that they're teaching that. And if you're going to get the most out of your singing, then I suspect that you have to keep that habit, but separate it from your everyday habit. And just know, Allison, that your body knows how to do this every day, all day breathing. And your body breathes a little differently when you're standing or seated than it does if you're lying down in bed. Your body breathes differently if you're picking up a heavy vase filled with water and flowers off of a table than if you're, standing stirring a pot type thing. And so your body kind of got this. Some of this is reflex. I think as a singer and an actor, it might not be a bad idea then, to do exactly what your instructors are telling you to do, but also to consider breathing, these types of breathing exercises, where when we're in a postural position that we are asking the pelvic floor to come up to meet the diaphragm as it's going down. Something to consider. Allison, let me know if that helps, or if you have any other questions on that. Super happy to stay right here and answer more questions. Mikhail, you're very welcome. And Lainey, so very, very welcome. Carla, who was the author of the Back Mechanic book? That's Stuart McGill. The last name is spelled McGill. Stuart is Stuart. Brilliant. I would highly recommend that you watch the interview that we did. It's on my website. It is, if you go to my website, there's a tab that says, I think, information. And then once you click on that, it shows up in 3 columns in our blog. It's on our blog. We've revived the Alive and Well podcast. You're so cute. Alive and Well podcast while we are in quarantine. So we've been doing some extra interviews. Elizabeth, where do I live? Today we're in Virginia. So yeah, I was living mostly in California, but my family is here, and so we're kind of back and forth a bit. And Jill, what was the YouTube video title at the beginning? Breathing in the... So I've done a lot of YouTube videos recently. If you go, the most recent one was Breathing and the Rib Cage. And it was about basically why do we focus so much on breathing for scoliosis. It's a great little video. It's a good, if you're working with people with scoliosis, it would be a good one to watch. Yeah. Or anybody with rib restrictions, not just scoliosis, but rib restrictions can mean so many different things. If we have if we have pathologies to our breathing that affect our breathing patterns, like even asthma, the muscles and the fascia and things just start to change there. So it can be good to focus on opening up restrictions, very much like these exercises we were doing at the end. I think this is again called Dove in Tai Chi, and focusing on getting things lifted and moving and as much mobility here as we can so that the breathing becomes easier naturally. Wendy, so glad you did this. Thank you. Very helpful and wonderful. Thank you for all you're doing during this time. Oh, you are so welcome. You all have always done so much for me, and super grateful for being able to teach these courses, and that you all showed up today. This was a fantastic turnout. And we've got lots more people receiving the free recording. Amy Davis, question. You're very welcome. And question, on the counting breaths, do the inhale and exhale need to be the same length of time? No. My thought is no. Yes, you're correct. Because we want a longer exhale. That is correct. When you have a moment, will you include the references via email? I didn't see them in the handout. Oh, if you didn't see them in the handout, it was because I changed the handout. So I sent 2 emails. If you got the email last night, that email didn't have the, it had the handout in it, but it did not have the references in it yet. And so if you go to the email I just sent you, it's going to have a link to my website, and then you can find the references there. The handout there, and it has the references, so it's all there. Carla, you're so welcome. Allison, what do you do with your low abs and pelvic floor when you inhale? Ignore them, contract them? And so, great question. If you are standing up, then the pelvic floor tends to come up to meet you. When, as Pilates instructors, because we work with so many women, we tend to, when we inhale, we're trying to get the pelvic floor to meet us. It doesn't do that naturally in a non-postural position. In a non-postural position, the diaphragm drops, the pelvic floor drops, everything goes down together, everything moves up together. But in a postural position, if things are working correctly, then as the diaphragm goes down, the pelvic floor should come up. And so that's probably, Allison, why your singing instructors have focused so much on dropping that pelvic floor, because it naturally wants to come up when you inhale if you're standing, and maybe they're doing that to create more space. I'm not sure. You can let me know, because I'm not a singer. But definitely we're not ignoring them. And then sometimes, yes, we are consciously contracting the pelvic floor to get it to come up to meet the diaphragm. Mm-hmm. Hello, Gus. Wendy says hello. He's a good boy. He's a good boy. All right. Kathleen, you're so welcome. Amy Davis, thank you so much. I've always wanted to attend a live workshop. This is as close as I can get right now. This is as close as we can all get right now. For sure. Allison, suggestion for exercise is expanding lung capacity without falling into overbreathing or deep breath in trap. Yeah, so the suggestion is that jellyfish breathing. So really, really focus on the exhale and let the inhale be free. If you're asking for the inhale, then the inhale you're going to most likely fall into an overbreathing pattern. Let the inhale just happen. Let the inhale just, your body knows how to do that. It knows how to inhale. If you've exhaled at all, then you're going to inhale. So just let your body do that. You're very welcome. All right, everybody, I think we did it. Great. So this was a fun class. And if you have any questions, please, shoot them my way, and I will definitely let you all know when we have the course approved for credits. So we'll have that online. It'll be a longer course, not much longer, but it'll be longer with some more details for you. So if you're interested in that, then that course will be available to you in the future. So take good care, everybody, and please stay in touch. You are not alone. We're all in this together. And I do have another free class on Thursday, and that one is focused on scoliosis exercises. So if you need them, or if your clients or patients need them, we will be focusing on that. And Nisreen, my husband does Tai Chi, and he sent me those breathing exercises. Oh, fantastic. Oh, great. Okay. Let me just copy and paste those. Thanks, Nisreen. I appreciate that. Okay, so you all take good care, and I will chat with you soon. I definitely don't have recommendations for online Tai Chi, but if they're like the rest of us, I'll bet there's some free courses online out there right now that you could take. So I would take a look at that. All right, everybody. See you soon. Bye.